The 19th century medicine was a total casino, where infection was rampant, and hospitals were often deadlier than the diseases they treated. In the midst of this chaos, one man discovered a simple, life-saving practice: handwashing. His name was Ignaz Semmelweis. But instead of being hailed as a hero, he was placed in a mental hospital. In 1847, Ignaz Semmelweis was working as a young obstetrician at the Vienna General Hospital. At the time, childbirth was a risky endeavor. In the hospital's maternity wards, the mortality rate from puerperal fever, a deadly infection following childbirth, was shockingly high, reaching up to 18%. Women feared giving birth in hospitals, and many referred to them as death factories. Doctors, despite their good intentions, often moved between patients, autopsies and surgeries without washing their hands. Semmelweis was determined to understand why so many women were dying. He meticulously compared data between the hospital's two maternity wards. One ward, staffed by doctors and medical students, had a much higher mortality rate than the other, which was run by midwives. The breakthrough came after the tragic death of his colleague, Jakob Kolechka. Kolechka had accidentally pricked his finger during an autopsy and later died from symptoms similar to puerperal fever. Semmelweis realized that something, what he called cadaverous particles, was being transferred from autopsies to living patients by doctors' unwashed hands. His solution: hand washing. Semmelweis implemented a simple policy: doctors and students had to wash their hands with a chlorine solution before examining patients. The results were astounding. Mortality rates in the doctor-run ward dropped from over 18% to just 1%. For the first time, childbirth in the hospital became safer than delivering at home. Semmelweis had uncovered a groundbreaking truth: hygiene could save lives. But instead of embracing his discovery, the medical establishment dismissed it outright. Many doctors were offended by the implication that their hands were dirty and contributing to their patients' deaths. Despite overwhelming evidence, Semmelweis's ideas were ridiculed. He was accused of being unscientific and irrational. Some even argued that puerperal fever was caused by bad air or the moral failings of women, not the actions of doctors. Frustrated and isolated, Semmelweis left Vienna and continued his work in Hungary. There, he achieved similar success with hand washing, but his mental and emotional health began to deteriorate. He became increasingly combative, writing angry letters to his critics and alienating even his supporters. In 1865, Semmelweis was deemed insane and committed to an asylum. His fellow physicians lured him, under the pretense of visiting one of new institutes, to a Viennese insane asylum located in Lazarettgasse. When Semmelweis realized what was happening and tried to leave, he was severely beaten by asylum guards, secured in a straitjacket, and confined to a darkened cell. Apart from the straitjacket, his treatments at the mental institution included dousing with cold water and administering castor oil, a laxative. He died only after 2 weeks, on the 13th of August, 1865, aged 47, from a gangrenous wound due to an infection on his right hand, which probably had been caused by asylum guards who were beating him. Years after his death, Semmelweis's ideas were vindicated by the work of Louis Pasteur and Joseph Lister, who proved the existence of germs and revolutionized medicine. Today, hand washing is one of the simplest and most effective ways to prevent infections, a legacy of the man once mocked as an idiot washer.